Imagine your lungs as delicate balloons, nestled safely within your chest. Now, picture one of those balloons suddenly springing a leak. That, in essence, is pneumothorax, a condition where air escapes from the lung into the space between the lung and the chest wall. This can cause the lung to collapse, leading to breathing difficulties and other complications. In this video, we'll explore the causes, symptoms, diagnosis, and treatment of pneumothorax, shedding light on this potentially serious medical condition. So, what causes air to leak from the lung and cause pneumothorax? There are several possibilities. Sometimes it happens spontaneously, without any clear injury or underlying lung disease. This is called primary spontaneous pneumothorax, and it's often seen in tall, thin, young adults, particularly smokers. Another type, secondary spontaneous pneumothorax, occurs in individuals with pre-existing lung conditions like COPD, asthma, cystic fibrosis, or lung cancer. Trauma to the chest, such as a car accident or a stab wound, can also cause pneumothorax. Finally, certain medical procedures like lung biopsies or insertion of a central line can inadvertently puncture the lung, leading to air leakage. To understand pneumothorax, we need to delve into the mechanics of breathing. Normally, a negative pressure exists in the pleural space, the area between the lung and the chest wall. This negative pressure acts like a suction cup, keeping the lung inflated against the chest wall. When air enters the pleural space, this negative pressure is disrupted. The air accumulates, compressing the lung and preventing it from fully expanding with each breath. This reduced lung volume leads to shortness of breath and can, in severe cases, impair oxygen exchange in the blood. If the pressure continues to build up, it can shift the mediastinum, the space containing the heart and major blood vessels, potentially compromising blood flow and becoming a life-threatening situation known as tension pneumothorax. Pneumothorax affects people of all ages, though certain demographics are more susceptible. Primary spontaneous pneumothorax, as we mentioned, is more common in young, tall, and thin individuals, particularly males who smoke. Secondary spontaneous pneumothorax is more frequently seen in older adults with underlying lung diseases. Traumatic pneumothorax can occur at any age, depending on the nature of the injury. The incidence of pneumothorax varies depending on the population studied and the diagnostic methods used. The symptoms of pneumothorax can vary depending on the size of the air leak and the underlying health of the individual. Common symptoms include sudden chest pain, often described as sharp or stabbing, shortness of breath, and a dry cough. Some people may also experience rapid heart rate, fatigue, and cyanosis, a bluish discoloration of the skin due to low oxygen levels. In tension pneumothorax, symptoms can progress rapidly and include severe shortness of breath, chest tightness, and even loss of consciousness. It is crucial to seek immediate medical attention if you experience any of these symptoms. Diagnosing pneumothorax typically involves a physical exam and imaging tests. During the physical exam, a doctor may listen to your lungs with a stethoscope and notice decreased or absent breath sounds on the affected side. Chest X-rays are the most common imaging test used to confirm the diagnosis. The X-ray will show air in the pleural space and may reveal a collapsed lung. In some cases, a CT scan of the chest may be necessary to better visualize the lung and identify the underlying cause of the pneumothorax. Pneumothorax can be broadly classified as spontaneous or traumatic. Spontaneous pneumothoraces are further divided into primary and secondary types, as previously discussed. Another important classification is based on the size of the pneumothorax. A small pneumothorax involves a smaller amount of air in the pleural space and may not require immediate intervention. A large pneumothorax, on the other hand, can significantly compromise lung function and requires prompt treatment. Tension pneumothorax is the most severe type, characterized by a build-up of pressure in the chest that can obstruct blood flow and lead to cardiovascular collapse. Treatment for pneumothorax depends on the size of the air leak, the severity of symptoms, and the overall health of the individual. Small pneumothoraces may resolve on their own with observation and supplemental oxygen. Larger pneumothoraces often require intervention to remove the air from the pleural space. This can be accomplished with a needle aspiration, where a needle is inserted into the chest to withdraw the air. Another common procedure is chest tube insertion, where a tube is placed into the chest to drain the air and allow the lung to re-expand. In some cases, surgery may be necessary to repair the air leak and prevent future episodes of pneumothorax. Pain management is also an important aspect of treatment. While it's not always possible to prevent pneumothorax, there are steps you can take to reduce your risk. For smokers, quitting smoking is the most important preventive measure. Smoking damages the lungs and increases the risk of both primary and secondary spontaneous pneumothorax. If you have an underlying lung condition, it's important to manage it effectively with medication and lifestyle changes. Avoiding activities that could lead to chest trauma can also help prevent traumatic pneumothorax. If you are undergoing a medical procedure that carries a risk of pneumothorax, discuss the risks and benefits with your doctor. The prognosis for pneumothorax is generally good, especially with prompt diagnosis and treatment. Most people recover fully without long-term complications. However, recurrence is possible, particularly in individuals with underlying lung disease or those who continue to smoke. Research continues to focus on identifying individuals at high risk of recurrence and developing more effective strategies to prevent future episodes. Minimally invasive surgical techniques are also being refined to reduce recovery time and improve outcomes. Further research into the genetic factors that may predispose individuals to spontaneous pneumothorax is also underway.